Hello everyone, so we're continuing with adolescent medicine confidentiality is regarding where adolescents are separately importance in the medical care. They want to know that information will have disclosed to the doctors, not revealed to others. Other parents school or police without their permission. Most circumstances, the confidentiality should be kept unless they seriously serious harm, intend to themselves, neglect sexual abuse, and suicidal thoughts, or to others who miserable intent. Difficulties relating to confidentiality for adolescents are usually about contraceptions, abortion, STIs, sexual abuse, and mental health. It's usually desirable for the parents to confirm them well in the management of these situations where adolescents should be encouraged to tell them or allow the doctor to do so. However, the young person is incompetent to make this decision for himself or herself. The courts have supported medical management in these situations without parental knowledge or consent. Range of health problems also consider a healthy stage of life compared to early childhood or old age. In spite of this, majority of young people consult their general practitioners more than once in a year. 22% of 11 to 14-year-old report a long-term illness or disability. Range of health problems affecting adults include common acute illnesses, respiratory disorders, skin conditions, musculoskeletal problems, including sports injuries and somatic complaints. Acute serious illness have become rare, with mortality predominantly from trauma, chronic illness and disability, asthma, epilepsy, diabetes, cerebral palsy, juvenile, idiopathic arthritis, sorry, sickle cell disease. There's also a range of what's happening. There's also a range of uncommon disorders with serious chronic morbidity, such as malignant disease, connective tissue disorders. In addition, children um, with many congenital disorders, often used to be fatal in childhood or survival into adults or adult lives, is fibrosis, Duchenne muscular dystrophy, complex congenital heart disease, metabolic disorders, hyperresistant somatic symptoms, fatigue, headache, backache, chronic muscular pain, mental health problems, including anxiety, depression, suicide, deliberate self-harm, eating disorders, and weight problems, also associated with health risk behaviors such as smoking, drinking, drug abuse, and sexual health perception and teenage. Against mortality, dramatic improvements in mortality beyond children seen since the 90s have not been matched in persons which who now have a higher mortality rate of 1 to 4 in old age groups. Also, deaths in adolescents from communicable diseases have declined markedly. This has not been matched with mortality from road traffic accidents, other injuries, and suicides in these now predominant. Alcohol is thought to be a factor in one-third of these deaths. Mortality rate in UK for 15 to 19 years is now greater than for 1 to 4 years. Impact of chronic illness, images of biological, psychological, social development. In addition, these developmental changes may affect the control and management of the disorder. Impact of chronic illness on children, young people, and their families is considered. Adherence to suboptimal adherence is a problem for many children people, including adolescents, as they are beginning to take over management of the health, wish to avoid parental supervision when making the management of the illness a lower priority than social and recreational activities. It may not be due in part to the development state of the brain that taking the medication really matters, especially if it is preventative or long-term rather than short-term benefit. Aspects of social and psychological groups in development, such as peer relationships, body image, and self-identity, are very important in considering adherence. For example, it may be more important for adults with diabetes to last properly, so she can sit with his or friends rather than go to the school nurse first for instance. Injection side effects are also important, particularly those that affect well-being of parents they may risk differently from adults. They may assess risk differently from adults so that the risk is not being one of the their crowd because of having to adhere to certain treatment may appear to be more important than the risk attached to not taking any medication. Adherence may be influenced by lack of knowledge and or poorly equipped for this disease. Education, the disorder may have presented when the child is much younger, so that the initial consultation will have taken place primarily in the doctor parents. This medication has not been updated with increasing age. Adolescents' knowledge may be poor with little understanding about his or her illness. What medication is she She's taken via the responsibility for management needs to the young person. Information needs to be provided about medications and treatment needs to Causes of death 15 years to 19 years in England and Wales, 2017, total number is 752. External causes, including ocean poison, 56%. Cancer is 14%, circulatory 6%, excessive 7, respiratory 4%, infection 3, and others are 10%. And be appropriate for his or her development. Other ways to maximize health are summarized. The implications of their condition on the rest of their health and their life needs to be considered. This may include sexual health, future vocational development, including the need for disclosure of their rights under the Equality Act 2010. Similarly, the implications of other health risk behaviors such as substance misuse, diabetes, and cases may need to be discussed. Some chronic conditions during adolescence, chronic illness or disability may disrupt adolescent developmental, biological, physical, psychological, social, and or vocational consideration should be made of the impact of the chronic condition on the rest of health, including sexual and reproductive health as well as education and like fatigue, headache, and other somatic symptoms. Fatigue, headache, abdominal pain, backache, dizziness are common in adolescent in large school-based surveys of young people in UK 65 teenagers about 71% of girls report experiencing at least one health complaint on a weekly basis. Such reports are more common in girls and also inclusive age of 24. 24% of 15-year-olds and 48% of girls reporting headache, 28% stomachache, 22 and 30% backache, and 30.9% reporting sleep problems more than once a week, respectively. Many of these symptoms appear to be feature of adolescent development, although organic disease must be included by history examination, occasionally investigation. For a minority, they may be physical manifestation of psychological problems and are precipitated by or maintained by factors such as bullying or parental discord. This is considered further under persistent unexplained physical symptoms in very we already done that. Occasionally, the symptoms are so severe and persistent that they considerably affect quality of life with impairment of school attendance, academic results, and peer relationship. Multidisciplinary rehabilitation within the family and cognitive behavioral therapy may be beneficial. Mental health problems, supervision mental health problems in adolescents have been reported to be 43% of 11 to 16-year-olds and 16.9% in the 90s. The main problems are listed, although adolescents are at much less risk of severe illnesses from COVID-19 than adults. The pandemic has had a major impact on the lives of adolescents in terms of mental health and on their social educational based systems that are further in Chapter 24. So this is some of the ways in which chronic illness and well-being interact with each other. Effect of chronic illness, delayed puberty in biological, psychological, and social. Delayed puberty starts to reduce bone mass nutrition, malnutrition, secondary to inadequate take due to increased caloric requirements of disease and or anorexia, localized growth abnormalities, inflammatory joint disease, premature fusion epiphysis, effect with development of chronic illness, pubertal hormones will impact on disease, growth hormones worsen diabetes, and increase insulin requirements, giving cystic fibrosis may have deterioration of function, corticosteroid toxicity worse in the pre-pubertal phase, increased caloric requirement may worsen disease control or results in undernutrition may need dietary supplements or overnight feeding with no potential to get sustainable growth may cause scoliosis, psychological regression to less mature behavior, a toxic role, impaired development of self-attraction and attractive sexual self, and parental stress, depression, vanished forms of providing care, severe suffer, deny that their health may suffer from their actions, poor adherence and disease control for genetic spirits. Social reduce independence when should be separating failure of peer relationships, social isolations, unable to participate in sports or social events, school absences, and declining school performances may low self-esteem, vocational failure. Risk behavior may adversely affect disease, smoking, and smoking, asthma, cystic fibrosis, alcohol and diabetes control, sleep deprivation, and epilepsy. Chaotic eating habits lead to malnutrition or obesity. Ways to maximize adherence, assess the size of the problem and be non-judgmental. Ask, some people have trouble taking their medication. When was the last time you forgot? Take time to explain practicalities. Try to put yourself into those shoes and think through the detail of their regimen with them, which is the most difficult dose to remember. How do you fit in taking your tablets in your daily routine? Make regimen as simple as possible. Do not forget practical issues. Food adherence may be as simple as not having a private space at school to take the treatment. Explore beliefs may harbor strange or incorrect beliefs about medication, false attribute, or side effect, and therefore refuse to take the medication. Use daily routines to anchor adherence. Find daily activities to anchor adherence to medication, percentage of breakfast and dinner instead of twice a day. Find the least chaotic time of the day, maybe morning or evening. Use alarms or phones. Let the sessions come from the adolescent. Motivation to negotiate short-term treatment goals, such for factors that motivate the young person. Ask 3 questions out of 10. How important, what priority, how confident are you that you take your medications? Involve in contract. Plan the resume as well, since some may respond to written contract that both sides agree to stick to. Written instructions. Most of what is said has been sure to be forgotten once they leave the room. Get them to take a photo of any instructions on their phone. Check level of knowledge on each occasion. Take time to explain. And solution focus approach. Find out what has been going well and why. Use information as to how have you managed to remain out of hospital for 3 weeks this month? Prevalence percentage of main mental health problems and disorders in 11 to 16-year-old by gender. Depression is 3.6 and 3.3. Anxiety is 8.3, 6.1. Attention deficit. ADHD is 0.8 and 3.3. Behavioral disorders 4.8, 7.8. Wow. Other less common disorders are 1.6 and 2.3, and any disorder 13 and 14.2. This is from NHS. Okay. Health risk behavior. During adolescence, young people begin to explore adult behaviors, including smoking, drinking, drug use, and sex. The experimentation behavior, often referred to as risk-taking behaviors, are part of adolescent development and reflects the adolescent's search for pleasure and excitement by participating in new and enjoyable experiences, as well as exerting independence from parents or rebelling against parents' wishes and lifestyle. There is also considerable pressure to fit in with peers. However, they have significant health implications when they can become risky behaviors. During adolescent development, young people may not always understand the risk involved, particularly if long-term, and may behave as if they are immune from harm. Participating in these activities may also deflect attention away from themselves to mass shyness or anxiety. Unfortunately, health behavior started in adolescence tend to continue in adult life. Sexual health, the average age of first sexual intercourse is 16 years, with brother or boys, a fifth of girls reporting having had sexual intercourse by age 15. Having sexual intercourse at an early age is often associated with unsafe sex. This may be because of a lack of knowledge, lack of access to contraception, ability to negotiate obtaining contraception, being drunk or high on drugs, or inappropriate being pressurized by his or her partner. Risk-taking behaviors also can result in STIs, unwanted pregnancy. STIs may result with urethral discharge, urinary symptoms, pain, unmaturation, abdominal line pain, or postcoital vaginal bleeding. Chlamydia is asymptomatic in 50% cases can lead to later infertility. Young teenagers more likely to present with vaginal discharge. Studies have shown that up to one-third of sexually active teenagers girls have an STI. They are also at risk of HIV infection. Management of sexually transmitted infection. Taking sexual history from adolescents should be approached sensitively in a developmentally appropriate manner, giving the young person warning of the topic as well as why the questions have been asked. Relevant questions include those related to the risk of STIs, number of partners, any partners during travel abroad, contraception use, whether vaginal, oral, or anal sex, any discharge, lower abdominal pain, urinary symptoms in the last menstrual period. However, many STIs are asymptomatic, especially in younger teenagers, male and female. If indicated, swabs should be taken for virology and microbiology to look for HPV, HSV, chlamydia, and gonorrhea. HIV testing may be indicated in England in response to high rates of chlamydia and that under 25 years age group. There is a national chlamydia screening programs enabling them to test themselves with easy to use kits. Treatment regimens vary depending on prevalence. Antibiotic-resistant chlamydia can be treated with azithromycin or doxycycline. Gonorrhea with this cephalosporin metronidazole can be added for community disease. It is advisable to inform and treat parents. The national HPV vaccination program for girls and more recently for boys in the UK is an excellent opportunity for constant conversations about sexual health in early adolescence and has probably been affected introduction of new diagnosis of genital warts for deception. Most adolescents who are sexually active are using contraceptions as by sometimes haphazardly in the UK, contraception is used by only half at first. Diffuse condoms, followed by the oral contraceptives, are the most common forms of contraception used as adolescents have a relatively high failure rate and the ability to use condoms correctly. And with the CPs having irregular use, a double Dutch method of condom, is advocated to protest against both STIs and pregnancy. Adolescents chronic disease, diabetes, even without microscopic contribution, donated started on lower doses of contraceptive pills. Some medication prescribed in adolescents are potentially teratogenic, retinoid with with GIA or other disorders, and may therefore need to be combined with an oral contraceptive or deeper hormonal implant. Discussions however, must also reinforce condom use to prevent STIs. An alternative to anti-epileptic drug helpers should be prescribed for those and females who may become pregnant as it is teratogenic. Finally, young people's accessibility to youth-friendly contraception services need to be checked as over half have been reported to be unaware of such services in their local area. Emergency contraceptions in the past misleadingly known as morning after pill can provide significant protection from pregnancy for up to 72 hours after unprotected intercourse. Emergency contraception is available from pharmacies without prescription for those 16 years and over, and on prescription for those under 16 years. If taken within 72 hours, it has a 2% failure rate. Side effects include nausea and lethargy. However, knowledge of emergency contraception poor among many young people. Teenage parenthood. The UK has the highest rate of teenage pregnancy in Western Europe, though encouragingly with a downward time trend. Teenage girls may present complaints such as abdominal pain, fatigue, breast tenderness, or appetite changes rather than delayed or missed menstrual period. Fatigue, becoming a teenage living in foster cultures as influenced by culture, there may be considerable support for from extended family this may work well. However, in those whose pregnancy was unintended or who are emotionally deprived themselves or who are unsupported living in poverty, there may be many inverse consequences for the mother and child. Children of teenage mothers have a high infertility, high rate of childhood accidents, illness, and emotional hospital being taken into care, no educational achievements, sexual abuse, and mental health problems, deprivation from their mother's lack of financial and emotional support, and the paucity of her own education and life experiences to her suspected predictive factors by having a supportive family. Religious belief in a stable long-term relationship with a partner. Health promotion reason to undertake health promotion endorsements, it is agreed for starting workplace behavior, smoking alcohol, drug misuse, unsafe sexual activities, and health problems. Promoting regular physical exercise, nutrition, health risk behavior, starting adolescence, often continuing into adult life. Health behaviors may have a direct effect on their lives. Teenage pregnancy, road traffic accidents, increased mobility, obesity, and diabetes. Main areas for health promotions are health risk behaviors and mental health. Violent behavior, physical activity, nutrition, and obesity, and parent adolescent communication. There are a number of approaches to health promotion for adolescents. Provide suitable information and user-friendly, developmentally appropriate way for young people. There are several website apps that provide health promotion websites as a whole, banning something advertising, making emergency contraception available in pharmacies. These can be very effective. However, there is increasing evidence that improving relationship under circumstances young people would be the most effective intervention for health promotion. Also, as adolescents often embark on more than one risk behavior that can be important. We reduce other risky behaviors, a program to reduce bullying in the whole school, and also reduce other behaviors such as drug misuse training. Programs to improve adolescents' ability to accept or reject certain processes of behavior that can be effective for their individual, but it's time-consuming and expensive. Drug promotion by professionals is solving. Adolescents not to smoke, eat a balanced diet, use contraception, etc., has not been found to be effective and will be counterproductive. Health professions do have a role in health promotion at an individual level. It is likely to be more effective and if targeted at those who are receptive or contemplating changes in their health risk behavior. However, motivation to use a technique uh, which which do not assume that they are ready to change their behavior, but aim to increase their intrinsic motivation. Teams have also been shown to be useful in this age. Will transition to adult services, adolescent and young adulthood. In comparison, many transitions to water social education remain, but I feel another one is health functions of all young people will need to learn how to navigate health services, adults, and know what who to contact with and when for different health related issues. A young person with a chronic childhood onset condition must leave pediatric and adolescent services with which they may have long-term relationships for um, adult services. This often involves training for treatment modeling based around roles based around close contact between the adolescent and health professional and telephone advice from clinical nurses, possibly home visits, frequent appointments, involvement with parents and other family members to one where they are likely to be seen less frequently than a busy adult clinic where parental involvement is minimal or discouraged. Main health problems also common accidents, respiratory disease, congestion, musculoskeletal problems, common illness, disability involving previously fatal congenital diseases, somatic symptoms, fatigue, headache, backache, and abdominal pain, and mental health problems and health risk behavior, smoking, drinking, drug abuse, shows up in accidents, and sexual health, sexual trauma, disease, conflict, pregnancy, eating disorders, and obesity. Young people and their parents need both information about the transfer process and time to prepare, including necessary skills to negotiate the adult healthcare system. Traditional and processes preparation, which by definition addresses the medical, psychosocial, and education needs as a young person moves from child to adult-centered services. Parents are often concerned that the adult team will not address the child's healthcare needs. It is helpful if an identified healthcare professional like a nurse specialist is responsible for coordinating transition arrangements. Whereas transitional care starts in early adolescence, some flexibility in the source which is desirable so that it can occur when the young person is developmentally ready and has the necessary tool to cope with adult services. Transitional care should ideally continue in adult care until the young person is successfully engaged and navigating health services effectively. Transition is triphasic and does not end at the point of transition. Transition will be via an adult to young adult services with clinics online, both adults and adult teams together. Uh, Such bridging arrangements have many advantages, but require sufficient number of patients and medical staff able and willing to provide the services. These clinics are usually for specialist conditions. Diabetes, GIA, cystic fibrosis, and congenital heart disease are genetically transmitted successfully in combination. There is a good communication between teams, although it usually involves a radical change in ethos of the recent and family. General practitioner ID is the source of continuity between training specialty practitioners and should be actively involved in the transition process. Transition to also transition care aims to address medical, psychosocial, education, personal issues as young people move from childhood incentive services. So this is all. Thank you very much.